When Chad Sabora needed help with his opioid addiction, he walked into a social services office with a desperate plea.
In 2011, literally was wearing a jacket and I was wearing short sleeves, and I took off my coat to show her my track marks. Please help me. And this woman, very sweet woman, who was in charge of signing people up for Medicaid, who I would assume should know about, she had no idea where to send me.
Today, Sabora's job is to make sure other people living with addiction can get connected to treatment.
Right? Oh yeah, just making sure.
He makes monthly drives through St. Louis neighborhoods where overdoses have occurred to help people where they are.
Grassroots of this was just out of our phones, Starbucks, just meeting people on the street until we were able to really get an organization together.
They distribute care packages and Narcan, which can reverse an overdose.
Anybody home?
He also leaves posters with a phone number to call for help, because navigating the world of addiction treatment without health insurance can be daunting.
They have to go to some pretty severe lengths. We have to have them lie to hospitals in order to get a bed for a couple days, just so we can work on some resources. They have to go to places that can offer sober living structures but don't have clinical care. I mean, it's piecing together a huge puzzle with really shabby pieces.
Over the past 6 years, the Missouri Network for Opiate Reform and Recovery has grown to fill this building in South St. Louis. The founders first met during a 12-step program. They're now in long-term recovery from their own addictions to opioids. But it's that experience that shapes their organization and the services they offer. When they distribute Narcan, it's to the people most likely to witness an overdose. If someone is struggling to get into treatment, peer counselors will vouch for them and offer support. Most recently, they opened a sober living apartment upstairs for 6 women.
Come on in. Kitchen. And they do have a curfew during the week, 11 p.m. We understand that relapse is a part of the disease. Everybody else wants to kick you out. We're not taking that approach. We're taking the approach, that's when they need us the most, is when their disease is coming at them. And so we want to re-engage them and try to get them back into the recovery process. We really want to build that family unit, and we want the girls to develop relationships like a family and learn those skills. A lot of them are coming off the streets, active using and things like that, or they're early in recovery and they haven't got those skills yet, right? They're still in survival mode. We want to get them out of survival mode and into feeling human and feeling part of a family and feeling, you know what I mean? So that's kind of our goal here, is to bridge the gap from survival to family.
But one of the big powerhouses behind the Missouri Network is a group of volunteers, affectionately known as the Moms.
People with substance use disorder have burned their bridges and really don't have much family left, so we welcome them here today so they can eat and we can bless them, that we can all be together. My boy was 21 and he fought that addiction for a long time. The moms get together every Sunday and we just chat about our children, and we have blessing bags. We fill those every couple months. There's usually some candy, some granola bars, some hand sanitizer, razors, Kleenex, hand warmers for the winter, stocking caps, gloves, socks. We put in an envelope with some stamps. Maybe they could write their family, some ink pens. Having an only child, I always thought after my boy died that I wasn't a mom anymore. But I'm a mom to all these kids, and we all love each other's children, so this is good for me.
To see more videos from this series on the front lines of a drug crisis, follow us on Facebook. Side Effects Public Media is a reporting collaborative led by WFYI in Indianapolis. Our partnership includes KBIA in Columbia, Missouri, St. Louis Public Radio, Illinois Public Media, WOSU in Columbus, Ohio, and WNIN in Evansville, Indiana.